Hello, I'm Dr. Lesia Waschuk, the Compliance and Education Specialist at Prep Doctors, and today I'll be speaking with Anne Genge, who's a certified cybersecurity and privacy expert for the healthcare sector. And those are the topics that we'll be talking about today as part of our series of video interviews for dentists and dental professionals. I have a couple of questions for you, Anne, as we begin our conversation. Can you please tell us how privacy and cybersecurity are related as concepts?
Well, they are quite related, and they get mixed up at times too. If we think about privacy, we hear about privacy a lot because there's privacy laws, there's privacy breaches. It's sort of with us all the time. It really shows up a lot in compliance as well. But privacy is mostly about protecting the identity of an individual, whereas cybersecurity is about protecting the systems and the data that lives in them. So they do relate together, but they are distinct topics, and they do have different strategies, of course.
So what is the importance of the data that dentists have in their systems that they use to operate their dental practices?
Right. Well, data in a dental practice, or really any business, is the heart of your business. That's where all of your information about anything you've done, any business you've done with them, any treatment, clinical, it is patient data. And we talk a lot about protecting patient data, but we really need to understand it as being our business data as well. And there's lots of things that we need to be thinking about. If we don't have all of that data that sits in that little black box in our practice, we really can't operate.
That's exactly right. We can't provide care to our patients. And the terms that are used that dentists may also have heard of: personal health information. So that's the terminology that's used in the privacy legislation. The heart of the practice, the heart of their business, they'll have heard the word goodwill, right? The goodwill of their practice really resides in those dental records that they have in their systems. And of course, there's other personal health information in some of the devices that they use to deliver care, and they need to protect all of that.
For sure. Anything where information is collected, used, or transmitted, they all become part of that record and need to be protected. That's absolutely true.
Right. And during COVID, when dentists were involved, especially in the earlier stages when dental offices were closed to all but emergency care, they were doing some teledentistry. They may have some of their staff operating from home on their own devices. And so additional considerations come into play, or maybe perhaps they need to look at the systems they have in place. I wanted to ask you in general, and for the information of our audience, what are the biggest challenges that you see in dental practices when it comes to privacy and cybersecurity?
Yeah, I think the biggest problem still is that dental offices are really responsible and fall under privacy laws and regulations the same way as large hospitals do, or other organizations. But they typically don't have the same kinds of budgets to put a cybersecurity program in place, security awareness training, or even many offices are still falling very short when it comes to privacy, having a privacy officer and policies. These are all big gaps.
So if I can pick up on a couple of things that you've said. So it's the budget, it's the staffing, it's training and education. And, dentists will be purchasing systems from one or more vendors. Maybe they require technical support. What else should they be looking for when they're investing in their systems that they need, their IT systems that they need?
Right. Well, one of the biggest gaps that I see is that dentists they spend lots of money, good money, on moving their practices forward. There's a lot that are really into the sort of digital transformation. They have all the types of integrated digital imaging and so on. But what ends up happening is IT providers, they'll provide the hardware, they'll sort of make everything connect and work properly. But then when a company like mine comes in and does sort of a security risk assessment, for example, dental offices among all of the healthcare sector, they fare very low when it comes to having the proper security protocols in place, policies, and protections. In fact, we did over 300 risk assessments from 2015 to 2020, and 93% of the dental offices actually failed. And they failed on some very basic things, just like not having proper passwords and unique user access, proper antivirus and security policies. So there's a lot of work to do. It doesn't end by just getting new computers. There are ongoing things that you need to do. They don't have to be super expensive. For example, in our organization, we use a lot of automation to make those things happen. But then we also have to really take a look at the people using the systems and really try to dramatically reduce human error that puts all this data at risk.
So you've used a few terms that are familiar to me from my work before I came to Prep Doctors: risk assessments, risk management. Mm-hmm. What would you describe as the biggest risks beyond human error, which or risk factor, I guess that is, to the data, the dental records at this time? Well,
that's quite an interesting question, because I attribute most risk to humans. When you look at, for example, the biggest threat channel is email. So if we have proper education in place, even if things get past our security filters, providing we've put them in place, a well-trained person should be able to identify a good or bad email a high percentage of the time. But what we also see is human failing in the way systems are set up in the first place or configured. I have responded to calls where backups, the dentist thought they were in place and they weren't configured properly and there was no data to restore. So really, almost everywhere you look, there's some sort of human element that creates that risk, either in not investing properly in the right equipment or not having the right qualified people put those things in place, and then right down to everyday people working with the systems and the data. So there's many vectors that need to be looked at. But as you know, we've talked a number of times before, my mission is to simplify it, make it easy, and make it affordable. So I don't want people to be overwhelmed by all this, because there are people, and hopefully they would choose me, right, to help them make sure that that's all in place.
So I love the way that you've come, I think, full circle, and also led us to the point where we can say that the risk is attributable to humans, but also the solutions are attributable to humans and the relationships that we build with the consultants that we have in our practices, perhaps the vendors that we purchase some of the software tools from, if they provide, that support. And I think how we manage the risk is largely in how we train our staff, how we learn what we need to know to configure the systems properly or to make sure that they've been configured properly. So Anne, I wanted to ask you about your vision for your company. How do you see yourself, and specifically the relationships that dentists need to have with all sorts of people within the dental industry and interprofessional, I'm going to say, education and learning out there in the dental industry?
Well, it's interesting. I think what we're known for sort of in the corporate side is providing cybersecurity software and cybersecurity solutions. But really, for me, my passion really is very much like you, to be an educator, spread the word, demystify technical concepts. I mean, cybersecurity, everyone knows they need it, but often become paralyzed and don't really want to look at that. So my mission is, how can I get as many people as possible to understand the sort of the foundational things they know or need to know to not only work in their practices, but just with technology in their everyday lives.
So as many people as possible. See, that's interesting, because that's, the potential for any company, I think, is to grow and to speak to a larger audience. What I think every dentist out there who's watching our video needs to think about is, how do they build relationships with the specific consultants, service providers, educators, and I'm going to say all the members of the interprofessional team they need to have in place in order to build the practice that they see, that they want going forward, right? So they're educating their patients about oral health care.
Right.
They'll need to make sure that their staff knows what they need to know about cybersecurity, about privacy, about all of the different aspects of compliance they need to be able to run their dental practice. They're going to need to know a lot about clinical dental practice as they grow into some of the dental specialty areas, as they work with dental specialists who support that growth, right? So it's for me, the way that I think of it is dentistry is a team sport, but actually you're on a whole bunch of different teams and they're bigger and bigger and bigger and bigger.
Right.
And you need coaches for all of the different roles you're playing as a dentist. You need coaches that understand the different stage of learning you're in for all of those different things. How do you feel about that sort of coaching model or rather than, teaching, let's say?
Yeah. Well, I think the coaching model has been sort of, the foundation of our whole organization always. One of the things that I was really put off by in my early days in dentistry, and that's going back to the 90s, is sort of the transactional type nature of certain types of organizations that would, sell equipment and then off they'd go. Especially today when we have so much connected hardware and software techniques, they need ongoing support. You need to know you've got someone that's going to be there no matter what happens. And I think that the only way to do it now really is with that and finding people to support you that have similar values. But let's face it, we out here working as coaches, mentors, or even suppliers of things, the worst thing we could do is not be constantly learning from the dentists as well, or whatever healthcare provider we're supporting. It's a circular thing. It should be. It's a reciprocal thing, and really, I guess that's what you're saying. Relationships are about, or teams are about, right?
So I think that's really beautifully said. We learn from each other, and I think that the generosity in passing on the knowledge that you've gained in the industry to new clients, that's something that I noticed about you in other educational offerings that you made during COVID in particular, and even before, right? Saying, this is what I understand about the dental sector. This is what I'm offering to the dental sector. This is why I'm passionate about the subjects that I am, because I see the need out there for dentists to know about this information and to share that knowledge with their staff. I want to thank you again for speaking with me today. I look forward to speaking with you again about cybersecurity, about privacy, and about other topics that relate to the provision of oral health care and in our effort to help dentists to be successful in their dental practices in this new challenging COVID environment. Thank you so much, Anne.
Well, thank you.